Good afternoon and welcome to the St. Clair County Daily Briefing for COVID-19. I'm here today filling in for Sam. She's over at the Health Department working on some of the numbers, so I'm joined by Director Simmons, but we'll get right into the report today. Tested, we have 74,199, which is an increase today of 1,015. Positive, there is 6,632, which is a daily increase of 49. Those are males and females in their teens to their 80s. That brings our daily county positivity rate to 4.8%, and our 7-day rolling positivity for the county at 7.6%. Negatives, we have 67,567. Unfortunately, we are announcing one additional death today, bringing our death total in St. Clair County to 180. That was a female in her 70s who did have underlying health conditions, and our thoughts and prayers go out to her family. For those that have completed the IDPH 10-day isolation period, we're at 5,813. For state totals, they've tested 4,688,976. Positive, they've had 259,909. That's an increase today of 2,121 new cases. For deaths in the state, they've had 8,295 deaths, which is an increase today of 22 new persons that have lost their life related to COVID-19. For hospitalization numbers, and these are for those hospitalized in St. Clair County, we have 54 COVID-19 related patients, and 2 of those patients are on ventilators. For our region today has 95 COVID-19 related patients and 9 of them on ventilators. Next, we'll move into the congregate living facilities that are in outbreak status, and that is 2 or more staff or residents that are COVID positive or have COVID-like illness. We'll only announce the changes that we have today. For Integrity Healthcare of Belleville, they have 1 new case, and Integrity Healthcare of Smithton, unfortunately, has 1 new death. And I'll now turn it over to Director Simmons for his report.
Thanks, Brian. Appreciate it. And I'm filling in for Chairman Kern today, who had another engagement. As we said before, county government still has to go on during COVID, and yes, that means on the weekends also. So he's entrusted us to get the message out there to you today. So we'll do the zip code report. 62059 stays the same at 11. 62201 goes up by 4 to 231. 62203 goes up 4 to 195. 62204 goes up 1 to 136. 62205 goes down 1 to 191. And as we said over the last 180 plus days, when we decrease a zip code number, it's due because somebody may have changed locations, or they found information when they were doing the registration, so we make sure that zip code gets corrected. 62206 goes up 3 to 425. 62207 stays the same at 238. 62208 goes up 1 to 400. 62220 goes up 5 to 521. 62221 goes up 8 to 622. 62223 goes up 2 to 380. 62225 goes up 1 to 30. 62226 goes up 2 to 686. 62232 goes up 1 to 184. 62239 goes up 3 to 97. 62240 stays the same at 31. 62243 stays the same at 94. 62254 goes up 3 to 235. 62255 stays the same at 16. 62257 stays the same at 35. 62258 goes up 1 to 176. 62260 goes up 2 to 128. 62264 stays the same at 90. 62269 goes up 2 to 519. 62282 stays the same at 12. 62285 goes up 1 to 79, and 62289 stays the same at 6. And that's the zip code report. Brian, numbers going down a little bit.
It is going down. We saw our daily positivity go down. But the important number to look at is that rolling positivity. You know, we announced our 7-day rolling positivity. Today it was 7.6. Regional positivity is also based on a rolling average. And today that does go down a little bit to 9.8.
Can you kind of explain some of the questions that we had last night on there? And as we have said, our confusion sometimes comes too. We're crunching these numbers daily. Explain to them how those positivity rates, what role they play, and how we come up with that.
Well, because the way the positivity rate is calculated and the fact that it's based on the tests that come in during that last 24-hour period. So because tests aren't taken and resulted on the same day, you know, we could be announcing tests today that might have been taken a few days ago. So it all depends on the labs and the time frame from those labs on how quickly the results come in. So that's why that rolling positivity is more important to look at than a one day. You can have one bad day if a lab either turns out a lot of tests or doesn't turn out many, whereas over the course of 7 days, you usually see that even out. So what we do to figure that out is we look at today and we go back for a total of 7 days, take the total new positives in that time frame divided by the total new tests during that time frame, and that produces our daily positivity. So today, where we have a daily county positivity of 4.8%, yet we saw our 7-day county positivity go up to 7.6 from 7.2. Well, the reason that is now 8 days ago was the day we had the 5,000 test results produced by the state. We had a very low daily county positivity, a large amount of tests. Well, when that falls out of that 7-day window, even though we had another very good day today, it still doesn't make up for that day that we had, 1,500 results come in.
Right. And like I said, I just thought it'd be interesting to explain that because we had some messages last night, and there's a lot of our Team St. Clair members that are keeping their own stats based on what we're giving them. But there are a lot that are asking questions about, what's the most important rate and how do you get to those figures? And as I say every day, the one that I watch all the time is that regional positivity rate, which today went down. We're down to 9.8.
Well, and don't get me wrong, everyone is watching the numbers, and until you really get down into them and look at these numbers every day, and as we've done before, you can almost kind of predict where they're going to go in the next day based on how many were tested, how many labs are producing, and don't get me wrong, we've expressed concerns we've had.
Yeah, we do. As we told, I had a call this morning from a business owner, a young man that's concerned about his business and wanting to know, are we going to go back to the phase 4, or are we going to have more mitigation? The 15th, we're up for that decision to be made by the state, but we worked late till last night until about 9 o'clock, crunching numbers and trying to get our mind wrapped around these numbers like yous all are, to make sure that we're doing our best. As we've said many, many times, we don't want businesses to close down. We want them to open back up. We want people to be able to go out to the restaurants and bars and
we just got to make sure when they're doing that, they're acting responsibly.
Yes.
They're wearing that mask, watching their distance, washing their hands frequently.
Yeah, because, even if we stay where we are on the mitigation, or if we go back to where we were before this last mitigation process, the virus is still out there. People are still getting sick. Another death in the county. Statewide, 22 people lost their life to COVID-19. And our thoughts and prayers go out to each and every one of them. As we say every day, one death is too many. But Team St. Clair, I think if we continue to wear the mask, wash your hands, watch the social distancing, as we say, we're all a part of the solution and not part of the problem. We become a part of the problem when we get lackadaisical and we take our foot off the gas. This thing isn't going to go away overnight. 180 plus days right now. I lose track of it. Every day's like Groundhog Day, as Sam says. But, please just continue to have patience. And when we say that for the business owners, we can say we feel what you're going through, but really we're not in your shoes. But we know with the mitigations that have been put out there on you, we understand. And here at the county level, Chairman Kern is on the phone daily with people trying to make sense out of all of this ourselves, because when I say we scratch our head every day, we do. And we're here with you. We're not just here from 8 to 5. In fact, sometimes, like I said last night, it was a late night we were here, and back today, and we'll be here through the entirety of this until we're all able to get back to what is going to be the new norm. But as Brian said, wearing the mask, washing your hands, watching the social distancing, and I've said this before, the physicians that we've had on here has said the same thing. There hasn't been a one of them that has said wearing the mask doesn't help. Is it 100%? No, we're not telling you that. We're telling you that if you and whoever you're around have that mask on, it is our best defense. And for the Team St. Clair members, we read all of those messages. We try to answer as many of them as we can. If we don't, it's just because we got busy and we have other duties that we have to do. But all of them get read, and we try to answer them. But we appreciate each and every one of you for what you do. Some of you have lost family members, friends. Some of you have had family members that's been sick by it. But please just continue to spread the word that we need everybody to be part of Team St. Clair, because we're all in this together. We'll be back with the young ladies to translate this into our Spanish communities, and then we'll be back tomorrow afternoon with your next briefing. Thank you.
Mask, gloves, soap, scrubs, TikTok, Grubhub, Twinks, jocks, bears, cubs. Zoom is the new club. 6 feet, no hugs, still beat these mugs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs.
Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs.
No school, gym closed. Don't touch these clothes. Need food, this blows. Line at Trader Joe's. At home, gym, fish. Don't come close. Just wave, wave, blow a kiss. Mask for mask, sis. Left, right, swiping on Tinder. What was life like? I can't remember. Needing my haircut, somebody shave her. Where is all of the toilet paper?
Gloves, soap, scrubs. Mask, gloves, soap, scrubs.
Okay, dolls, y'all know what time it is. Come on, stay inside and lock the door. Stay inside and